shame is too heavy. The shame is too much. At times, some people prefer to die. They say, what is all this? Those that used to open doors for you will close door on your face. Because they believe that there is no other hope. But with my own testimony, there is hope. Nigerian government should support all the dialysis centers in Nigeria. Because most of their machines are obsolete. If you do dialysis in Nigeria, you'll be breathing like frog. But if you do elsewhere, you will be breathing normally. You play football. The money they use for dialysis in Nigeria is about what? 45,000 naira, abi? But in India it's about 7,000 naira. You can see the difference. And again is that people go for checkups in India. Poor people. You don't even need to have money. They go to, you see them, if you come, everybody's checking their blood. The health consciousness is too much. But here, self-recommendation has killed us. A lot of people, once they want to eat, you know, the doctor said something about diabetes and hypertension. If they give you food, don't add salt to it. You know salt? You know salt? You want to put more salt so that it will be sweet. And again, look at what is happening in Nigeria today. A lot of people are drinking rubbish. They say it's supplementary, whatever. Drugs everywhere that didn't go through any NAFDAC, what's it called? And again, Nigeria, we don't rest. We work too hard. This body is meant to rest. Sugar level is so much that we wonder, are we human beings? And most of these things we eat with canned food. Most of the chemicals that they use to preserve these foods are terrible. And you want to eat it, and you feel okay at that point, but at the end of the day, what happens? You fall sick. You cannot trace it back to that food that what? You ate. So that is why it's so important that we take good care of ourselves. When it comes to donor, people are afraid to donate. Encouraging donors to donate, because as we are here now, it's only one kidney that is working. And if anything happens to one kidney, before you know it, the other kidney is affected. And listen to me. So why not you donate? And donation should be out of love. You know, people think that you buy kidney. You cannot buy kidney. Because if they put the cost of kidney, nobody can buy it. In fact, let me tell you, the person that donated for me gave birth to twins after the donation. You will live your normal life. That's what people feel, that once you donate, I mean, it's like your life is gone. It's a lie. What we face after transplant is that the cost of drugs. Listen to me. Doing transplant is one thing. Drugs you will be taking for the rest of your life is another. Because if you don't take it, the tendency for you to collapse is there.
Well, some kidney diseases are hereditary. For instance, some people have holes in the kidneys that we call cysts, and this can be inherited from one's parents. Some diseases that are also inherited, like sickle cell disease, for instance, although it's not primarily a kidney disease, but patients who have sickle cell disease can have kidney diseases, because we are now seeing so many people being affected with this disease, and the fact is that quite unlike what you see in many advanced countries, you are having most of our patients being young adults. So government can come in, strengthen the insurance companies, and enable them to be able to take patients who have kidney disease into their health insurance coverage. The problem with most people is that they don't have money as at the time they need to get to the hospitals. because they pay out of pocket, they are not able to afford the cost.
Formulate and come up with a policy that will help people, kidney patients, either by subsidizing the medications or by subsidizing the cost of transplant operations or subsidizing the cost of dialysis, as is being done in other countries.